Hi, everyone. Welcome to the Human Health and the Planet's Health session. I hope you all enjoyed the plenary. It was certainly innovative and inspiring. My name is Juli Trtanj. I'm with the National Oceanic and Atmospheric Administration, and I'm actually really excited to be moderating this amazing group of speakers we have for you this afternoon. The order is what you see in your agenda here, but just a couple logistical things. We are being live streamed, so the audience will be able to hear you but not ask questions, so the questions are still in the room. And I wanted to just sort of get us started on the same page while people are filtering in. I know the opening plenary went a little bit long, but you guys are all here now on time, and so we're going to go ahead and start. Human health and the planet's health. And why am I actually excited to be here? So this is a picture of an ocean. It looks like a planet to me. And we're all sort of very connected. I'm very much thrilled to have the opportunity to work for the agency I do. We're the guys who do the observation of oceans and atmosphere and land, and we're the prediction folks. We protect the marine species. We manage or try to manage their health. They pretty much manage themselves, and we think we're managing fisheries, but you know how that goes. We manage fishermen, and they manage themselves too. The most creative people in the world, I think, are probably fishermen. I used to do fisheries work, so you put a fisheries regulation out about the length of a boat, and then the boats become wider. It's very interesting. So, so we protect whales. We've got fisheries regulations as well, but we also have an environmental stewardship mission. So we get to do everything from the deep sea to the sky to in between. This is a ice cap in an iceberg in Glacier Bay. So we have the panoply of lower sea to upper atmosphere and managing some of the resources in between. We have an environmental conservation mission, and we're the people that get to predict stuff. So this map here is a really, you could give a whole talk, but one of the cool things about being on the data side of this is that we actually do observe a lot of this information, and it's how we're able to track some of these trends and indicators and things over time that are relevant to our health and well-being, and that allow us to predict things that will help us prepare and plan and reduce the impact of our footprint on the planet. I want to raise an issue here, though. The reason I put this observing system slide up here is this is a network of ocean-going vessels, deep-sea vessels from our ocean exploration program, buoys that are moored in the ocean, that are on our coastal systems, and this is a network of institutions around the world that observe our ocean, and there's a similar system for the atmosphere. It's even more complex. But what it allows us to do is predict. Like I said, I'm in the prediction agency, so we get to observe and predict stuff. So this is all very good. The topic here is human health and the planet's health. So I'm going to take an infectious disease example here, and we're going to hear more about this in the panel. But if you talk about how things currently work with an infectious disease outbreak, this is a generalized infectious disease curve, right? And there's an opportunity to control only a little bit of that, and that did not transfer well. I didn't check my own slides. So you have an opportunity from the first case of something, whether it's a disease in a zoonotic environment or whether it's an influenza strain, you have opportunity to control sort of at the end of a response. But if you were to able to move that bar forward using our observational systems and our prediction systems and our understanding of how we interact with the environment, and our ability to do something about that, you'd have the opportunity to really control a disease outbreak or some sort of health outcome before it even gets going. So then you have the other problem of, well, how do you monitor that? How do you know you're having an effect if there's not actually a problem to document? But that's a problem I think we could actually have.